The village of El Rejon, tucked away in the mountains of south-central Guatemala, typifies the poverty of Mayan villages across Central America. Indigenous Mayans make up the majority of the rural poor here in Guatemala, and 2/3 of them survive on about $2 a day. That puts quality dental care out of the reach of millions of people here, and makes the work of people like Don and Peggy Orth vital. Don is a retired VA dentist, Peggy, a registered nurse. Together, they have been doing low-cost dental clinics in villages across Latin America for 10 years. It's not easy work. The conditions make even routine extractions difficult, but none of that changes the Orth's fundamental reasons for coming year after year.
I feel very strongly about helping poor people, especially the Mayans. I love the Mayan people very much, and they are the poorest of the poor. They're very discriminated against, and they don't have access to medical dental facilities.
Today, Don and Peggy are working with Mission Impact, a Guatemala-based agency that ministers to the rural poor with multiple projects. Mission Impact is charging patients 5 quetzales, or about 65 cents, for today's clinic. This 62-year-old woman, who has lived in El Rejon for 36 years, says that dentists in nearby towns such as Zumpango and Antigua charge up to 70 quetzales for the same work.
Por mi parte mía, yo le agradezco bastante. Gracias por todos ustedes.
She said thank you.
Por los pobres, ¿verdad?
Thank you for help
yo sí le
for people.
Bastante,
she appreciates all the
más que
help.
Dios que le da ese mente, ¿verdad?
He thanks God for send people like the doctors here.
Most of the 2,000 people who call this village home earn their living farming the steep fields surrounding the town. Machete wounds are common. With no other medical professionals likely to visit the village anytime soon, a man with a deep cut in his arm shows up requesting stitches for it. It's not the first time Don and Peggy have seen this, and they treat the man right away.
And we've sewed up hands and fingers, legs. It's just a common thing.
Sometimes the Orths do get to work in nicer settings, such as this modern missionary clinic near Guatemala City. However, they've spent most of their ministry time in places much like El Rejon.
We use this simple little plastic chair for the patients, and it's totally non-adjustable. And very weak. I have to hold my leg underneath to keep it from breaking. And the lighting is very, very poor. The light I have around my head doesn't illuminate very well, and it's hard to see in the patient's mouth. Plus, we don't have a suction that is very powerful. So when you're doing extractions, multiple extractions, it's very, very difficult.
Despite the difficulties, Don says he'd rather spend his retirement working with the Mayan people than tooling around a golf course somewhere, even when it means fighting a losing battle against the poverty of his patients.
Well, I took one of her teeth out, and she's probably going to lose the other one I worked on because she won't follow up with anybody. I don't think there are any dentists around here, and surely none come here. It's gratifying to know that I've saved some teeth, and maybe in the future they can get a partial or some kind of replacement.
Yeah. Okay. That's it.
Okay.